Hi there. Welcome to another episode on our diabetes series, right? I am your dietitian Fechi, and in this episode, I'll be sharing with you treatment of diabetes. Now, a lot of people don't know exactly what to do when it comes to diabetes, and this is so painful. I see them almost every day doing things that are terrible, okay, things that can hurt their lives, okay, and I feel bad. I feel very bad, when I see people who are diabetic and they are not doing the right thing, okay. I try to help as much as I can, okay, to come out of this, but sometimes they can be very stubborn with their ideology on some of the things they are doing. Okay, so a lot of them will go through a lot of complications afterwards, and before you know it, they die. Now, this is not what I want you to go through. Or if you know somebody who is having diabetes, this is not something that you would like that person to go through. Now, it is important that you understand how the treatment of diabetes works. Okay, it is important that you appreciate it and embrace it. Now, it is not enough for you to, go to see a doctor and you get diagnosed and you're given all the medications and that ends it. No. Now, it is a journey, it's a marathon, it's not a sprint. Now, you don't stop there. If you're diagnosed and the doctor gives you a medication, now, there are two things about treatment that I will need you to understand. Okay, there are medical treatment of diabetes, which has to do with the doctor, giving you medication, diagnosing you, and giving you medications, right? Now, there's another aspect of medication which they are not medical, right? There is dietary, okay, is dietary management, and then there is diabetic education. There's diabetic education. Now, the dietitian can do this, the nurse can do this to educate you on what you need to know about diabetes. And other health professionals, they can do this to educate you on what you need to know. Now, but the dietary management is for the dietitian alone. And this is where we come in, right? I'm a professional dietitian and I know how many people that have, been doing the right thing in terms of their medicine. Okay, they are taking their medication, the way it ought to be, but they are not getting it right when it comes to, other aspects. They know little or nothing about diabetes, and then they know little or nothing about their diet. Okay, so they do things based on hearsay, and it's very dangerous to do things, based on what you heard. There's a lifestyle, there's lifestyle management, okay, of diabetes as well. You need to know what the lifestyle you need to change. You need to know what you need to start doing. These are, things that you need to understand about diabetes. And it's a very essential thing that you do it. Now, medically, you need to learn to take your drug seriously. You must take your drug as at when you. You must take your drug if you're given a medication, in pairs. You're asked, probably maybe the doctor said you should take metformin and dialine, or any of those medications. They combined it to two, right? Now, you need to take it seriously. You need to take them, whether it's morning and night, you need to take them as you are told. Now, there are times you discover that your medication is no longer that effective. Now, it is possible to happen. Now, what you need to do is to go back to your doctor, that doctor that knows your history, okay? That doctor is able to know what exactly happened, okay? And to prescribe a new drug when necessary. Okay, it's not a time for you to go to a new person unless the person is no longer close to you. But when you have a medication crisis, maybe your medicine is no longer working, or something happened on the insulin dose is no longer enough. There are times people that take insulin, probably you may need to increase your insulin dosage, and you're taking insulin, but your sugar keeps rising, right? Now, this is all what the doctor will need to look at, and then to know how to go about it, whether to increase your dose of insulin or to change medications for you. Okay, these are things he will do because he is the person that knows your history. So don't go to a new person who will start all over again. And this is why we complicate our health. We don't maintain a particular doctor or particular hospital, at least where they can go through your file and follow your history. Okay, so but it is best to do that. It is best to go to a place where your history is already captured, so that they will continue from where they stopped. Okay, now the second management is, of course, diet. Now, a lot of people are doing the right thing in terms of medication, like I said, but they are not taking their diet seriously. Okay, now diet is very, very essential. I can go on and talk about it for the rest of the day. Now, you need to know that in our previous videos where we shared about what happened during diabetes, I made you to understand that there is what is called insulin is the key that opens up the cell for sugar to have access to the cells, and for the cells to have access to sugar and make use of them daily. Now, what happened during diabetes is that this key is no longer functional. Okay, this key is no longer functional, either because the body is not producing the key, or the key is not recognized. Right now, there is also another improvisation that is made, you know, in the form of fiber. Fiber helps your sugar not to overwhelm the bloodstream. It finds a way to limit how sugar, accumulates in the bloodstream. Okay, so fiber is very, very, very essential. And that is why for dietitian, they give you a high fiber diet. Fiber will become your friend, and they know this diet. And that is why you need to go see a dietitian who will prescribe an appropriate diet that is suitable for you. Okay, now what you need is a moderate carbohydrate. Moderate carbohydrate is not that you run away from carbohydrate. I've heard people say it, that once you have diabetes, everything carbohydrate, forget about it. Now, let me tell you the truth. You cannot do without carbohydrate if you must live. Yes, that is the truth. You can never, never run away from carbohydrate. Never, never run away from it. You can't. You need carbohydrate for you to live. And that's how God made it. So anybody that is telling you low carb diet, no carb diet, that's not true. It's not obtainable. Why? Because the cells of the body work with sugar. Your brain work with sugar. Your muscles work with sugar. So how can you do anything without sugar? How do you run away from it? So you need sugar for every part of your body for you to be a living being. You cannot live without sugar. I'm telling you, anybody that is trying to tell you otherwise is deceiving you. So For people who are vegans, they find a way around it to even have access to sugar. So, moderate carbohydrate is key. Moderate carbohydrate, and that's why you need a dietitian who will calculate your calorie, who will help you calculate your calorie, the calorie that's coming from, carbohydrates, and tell you so that you will be weighing them out in gram. The cooked food, you know the quantity of every food you need to take. This is what we do. We tell you exactly the amount of the food you need to take for every food you want to take. Even foods that we don't know about. All you need to do is to ask us, and we will provide you with the quantity that you need. And that is why you need to join our program, because that is where we listen to people. We cannot reach you through this medium, okay, to tell you everything that we need to tell you. That is why you need to join the program, okay? So, moderate carbohydrate, high fiber diet, and then, high protein diet, and also a moderate fat, okay? So, this is exactly what you need. All right. You're not going to overtake any of this food. You're not going to overtake any of them, right? You need to understand what the treatment is, the dietary treatment. You need to understand it. And the only person that will provide this is the dietitian. Okay. So go see your dietitian and he will help you understand some of these things. Come to us. Who am I sending you to? I don't know what I mean by go see your dietitian. I mean, you should come to us. Let us help you to bring those numbers, that are high to, a normal level. Okay? Exercise. Now, a lot of people don't know the powerful secret behind exercise. In the control of your blood sugar as a diabetic, you don't know how powerful exercise is. A lot of you think that exercise is about going to the gym every time and carrying lifting and all. No, that's not it. That could be it for some people, but that's not it. For you, you can exercise without going to the gym. You can do an effective exercise right there in your room. You can do an effective exercise right there in your compound. You can do a very effective exercise anywhere you are. You just need to know. You don't know more. You don't know more than you know now. Exercise is so powerful. Let me tell you one of the things that exercise do. Now, the muscles in your body, like I said earlier, the muscles, they make use of sugar. All right? Now, they make use of sugar, and when they make use of sugar, what happens is that when you exercise more, you excite the cells in that muscle that they go in search of the sugar, because the blood flows through the muscles. So they go in search of the sugar as much as they can. So they take more sugar instead of waiting for the sugar to be brought. They probably excited to produce more insulin, and then you will have, more insulin for the sugar in your blood to be absorbed. So whenever you exercise, that's the muscles, are excited, and they, mop up sugar from the blood. Okay, they mop up sugar from the blood and then thereby dropping your sugar. This is what many people don't know. Many people that are you see people that are suffering and they are doing, like, they don't know that exercise is powerful. That is one of the lifestyle changes that need to happen. Okay, and then you stop smoking alcohol. You find a way to. Alcohol is not that you may stop, right? But you need knowledge to understand. I'll do a separate video about alcohol intake as a diabetic. Okay, I'll do that as a separate video. But alcohol needs to be in moderation. If you must take it, it needs to be in moderation. Okay, so that you will know, exactly how your body responds to the sugar in your body. Okay, now this is where we draw the curtain on today's episode. I know you've gotten value. Okay, now I'd like you to subscribe to this channel, click on the notification bell, and then like it and share. Okay, I'd like you to share it and then let more people have access to it. Now, if you want to reach out to me on my social media platform, in all our social media platform, go to the description. You can click on them and come connect with us. Okay, we'd like to hear from you. Share in the comments. Let's know what you think about this video. Is it something that is valuable to you? Let us know. Thank you very much for listening, and I will see you next time. Bye for now.